Hello, hi, my name is Temita Kweshewanjo. In this short video, I'm going to be performing non-parental medication. To start with, I have here printed my physician order and the medication order. And I'm going to be comparing the two documents in order to validate the sixth right, which is right to patient, right to medication, right to dose, right to route, right to time, and right to documentation. So I'm going to be going over the physician order. I'm going to be comparing it with the medication record in order to verify if the correct information is documented in the medication record from what the physician order. So going by the two papers, I'll first look for the patient name, which is Buza Jack, the MRN number, medical record number 8734651, well documented in the medication record, and from the physician order, same. Date of birth 06/2019 that same. The name of the physician, Allen Long, MD, which is well documented. Then looking at the date, it says 02/17/2020 correctly documented in the medication order, and the same thing appears on the physician order. The first medication, according to the physician, it says cefaclor 500 mg POQ 4 hours for infection at 8:30 a.m. to be administered time, which is correctly documented in the medication record. The second medication is Synthroid 100 mcg POQ AM. It's also well documented in the medication record. And the third medication, 08 Nitrobid 2% ointment topical QAM 1 inch on patient chest, well documented on the medication record. Nitrobid 2% ointment topical QAM for the date on the date of 2/17/2021, and also the right time 8:30 a.m. The signature of the physician was appended on the physician order, while the person that documented the medication record also append a signature. So it says no known allergy on both papers. So this means what the doctor ordered is well documented in the medication record. So there is no fault detected. So in this video, I'm going to be doing 3 checks. To start with my first check, I'm going to be performing hand hygiene. I will get my hand sanitizer. I'll put on my glove. Then, from the record I have here, medication record, I'll be pulling out from the drawer to do my first check. I'll be pulling out from the drawer my medication. So I'll go over the medication record again, looking for the first medication according to what the physician ordered, which is cefaclor 500 mcg or Q4 hours for infection. So pulling out, I'll till out the drawer. So I got my cefaclor. This is cefaclor, but what I have here is 250 mg by 5 ml for the cefaclor. So the doctor asked me to administer 500 mg POQ4. So I'm going to be calculating the accurate and appropriate dosage to be administered. When it is time, I will calculate that. And then the second medication is Synthroid 100 mcg. I pull it out from the drawer. I got here a dose, a single dose of Synthroid, which is 100 mcg. So the Synthroid is accurate dose, very good, that I'm going to administer to my patient. I'm going to put that in the cup and set that aside. Then I want to confirm the third medication by looking at the book again, the medication record. I have Nitrobid 2% ointment topical QAM 1 inch on patient's chest. I pull it out from the drawer, and I was able to see a Nitrobid ointment. So it says it should be administered on the patient's chest. Then I'll make sure I pick along a paper on which I'm going to measure it before I can administer it on the patient. So for my first check to be completed, I'm going to be comparing the information I have, looking for this medication in the book, and I'll be using my nursing drug preference book in order to validate all this information. So going over the book, I will look for the cefaclor. For the cefaclor, the generic name is cephalosporin. The dosage says is adult PO 250 to 500 mg Q8R for the cefaclor, and it is used to treat bacterial infections such as pneumonia. Then I will look for the side effect: dizziness, diarrhea, stomach upset, headache, and vomiting. From what the doctor prescribed, it says cefaclor is used for the treatment of infection, which is right, but I noticed it says for 8 hours in the book, but the doctor stated 4 hours in his own prescription. I know there must be a reason for him to have done that, which I'm going to ask him later. Then for the second medication, which is Synthroid, I'll open to the Synthroid. It says Synthroid 100 mcg PQA. So Synthroid generic name is levothyroxine, and what what it is used for, it's used to provide more thyroid hormone. It says this dosage in an adult less than 50 years, PO 160 mcg kg per day. And from what I have here in the doctor's prescription and medication record, it said Synthroid 100 mcg POQAM, which means that it goes within the age range of the patient, which is very okay. The Synthroid is okay according to what the prescription says. So I will watch out for the side effect. That is, what are those things that you look for in the patient after you administer the medication. For Synthroid, you look for sweating, headache, anxiety, insomnia, nausea, fever, and hot flashes. Then for the last medication for this patient for this period, it's Nitrobid 2% ointment. For the Nitrobid, I'll go straight into looking at the classification. The generic name is nitroglycerin, and is a rectal ointment, and its action is it decreases preload and afterload, which are responsible for decreasing left ventricle and diastolic pressure, systematic vascular resistance, dilate coronary artery, improve blood flow through coronary vasculature, dilate arterial and venous beds systematically. What it's used for? It's used for chronic stable angina pectoris, prophylaxis of angina pain. Then it says administer. How do we administer the Nitrobid? It says should be measured on paper supply. Use paper to spread on non-hairy area of chest, abdomen, thigh, skin, thin layer, spread over 2 to 3 inches. Do not rub. There is an instruction there that should be spread on non-hairy part, and we should not rub. And it says that you should measure 2 to 3 inches, but the doctor said 1 inch on his own prescription. There must also be a reason for that. So I'm done with my first check. Now I'm going to take off my glove, perform hand hygiene again, and get a new glove. Then I'll be going to do my second check. In doing my second check, I'm going to be measuring the quantity of medication to be administered to my patient. So since I have my Synthroid, which is 100 mcg ready here according to what the prescription says on the documents and the medication record, and I have my Nitrobid, with the paper. I'm going to leave this till I get to the patient room. I'm not going to do anything with the nitro bead. Likewise, my centroid, I'm not going to do anything with it until I get to the patient's room. I'm just going to keep it in the cup. But for the Sevaclor, I'm going to calculate the amount of the amount to be administered to my patient. Since what I have here is 250 by 5 mg, looking at what I have here, so it's going to be 5 ml, 250 milligram by 5 ml. It's going to be 5 ml over 250, which is my known, equals to x over 500, which is unknown, over required. So it's going to give me unknown equals to 5 times 500 divided by 250. Then I'll use my calculator to complete the calculation. This is 2500 divided by 250 gives me 10 ml. So that is to say I'm going to administer 10 mils of Sevaclor to my patient. I'm going to be administering 10 mils of Sevaclor to my patient. So I have here my cup seated on the table. Then I'll go down this way in order to take the measurement for accuracy's sake. I'll go this way and I'll put the remaining one back. This is 10 ml. 10 ml of my Sevaclor is going to be administered. Now I have the 3 medication ready. My Sevaclor 10 ml according to what is written here. My Synthroid 100 mcg to be administered, and my nitrobid 2% ointment with the paper. Then I'll be stepping out to go to the patient's room. I'll take off my glove, perform hand hygiene, then I'll go to the patient's room. So in the patient's room, I'm going to be doing my third check. So when I get to the room, I'm going to be introducing myself to my patient. I'm going to be asking for verifying a name with 2 information, a name and date of birth, and after that I'm going to be administering the dog. I'll do the third check, then I'll administer the medication. So I'm now in the patient's room. The first thing, hello miss, how are you? My name is Temi. I'm a student nurse from Mountain View College, Dallas, Texas. I am here to give you your medication this morning. Before that, can you please verify your first and last name? Oh, Buzia Jack. Good. Can you please verify your date of birth? 06/20/1975. Good. That's fine. Okay. One moment. So now I want to do my third check. Now, going over what I have again, I want to affirm that I have the correct medication. Sevaclor. I have 10 mils of Sevaclor to be administered to my patient. I have my Synthroid 100 mcg. Then I have my nitrobid with my paper. So I'm going to perform hand hygiene again, and I put on my glove. Miss Buzia Jack, allow me to make you more comfortable while I'll be giving you your medication. I'll adjust the bed to a comfortable height. Then I'll raise up her head from sleeping position to make her comfortable. Then I'll provide privacy. The next thing is, now I'm ready to give you your medication. Do you have any allergy? Can you swallow? You feel good today? Fine. Please, I want you to open your mouth. This will be your Synthroid to help you to boost your hormone. Can you take this? Open your mouth. I will open the Synthroid. Before doing that, I'll open it. I'll put it in the cup. Then I'll put it in her mouth. I'll give her water to wash it down. Then I'm going to give her the Sevaclor. Open your mouth. In case she needs water again, I'll give her water to wash it down. Then the last thing I'll do on the medication is I'm going to administer the nitro B. So I'll put my paper down. I'll open the lid and I will measure 1 inch on the paper this way. Okay, I've measured 1 inch. So Miss Buzaja, please allow me to place this on your chest according to the physician instruction, and I'll make sure I fix it on non-hairy part of her chest, and I'll tell her, please do not rub. The instruction is do not rub. Then I'll place it on her chest accordingly. And immediately I'll take off my hand glove. I'll discard it. Then I'll perform hand hygiene. So Miss Bujaja, that is that for your medication for this period. So I'm going to lower your bed again, make you comfortable, you can relax. In case you have anything of concern, please feel free to talk to me or you call me. Here is your call bed by your bedside. I'll be stepping out to the next room. Please feel free to call me. I'll be here to attend to you. Thank you. Then for sublingual and buccal medication, the sublingual medication goes directly under the tongue. I'll put the sublingual medication under the tongue, and I will educate my patient not to swallow, not to chew, not to drink water while doing that. So why I put the medication is not allowed. Then I'll perform hand hygiene again, like I want to give another medication. Before I do this sublingual too, I will have done my hand hygiene before I do that. So after I perform my hand hygiene and I put on my glove, for the buccal, it usually goes in between the gum and the cheek. I will ask my patient to open her mouth. I'll put the medication right at the corner, between the gum and the cheek. I will tell my patient again, please do not drink water, do not chew, do not swallow, do not eat or drink with it. Allow it to dissolve naturally. That is for the buccal medication. Now for the instilling eye drop. To instill eye drop, I'm going to sensitize my patient by telling her you may experience some burning sensations, but then just to be aware, I will now tell her to open her eyelids, lower eyelids. So I will raise the dropper above her conjunctival sac. Then I will instill the appropriate drops in the eye. This way, once she's looking up, and I will instill the appropriate drops into the eye. Then I will apply pressure to the lacriminal duct. I will apply pressure to the lacriminal duct, and I'll ask her to close her eyes. And in case it's an ointment, I will apply it evenly and I'll have her close her eyes. In case I want to put a patch, and I will do that too for the eye. So that is for the eye. Then for the nasal, I will ask my patient to hold her nose and breathe. Then I will have her to be in a supine position, and I will make sure the medication is already warm in my hand under room temperature. I'll make sure she put her head is tilted to the back. Then I will instill the normal drops into the nasal. Then for the ear, I will ask my patient to stay sideways for 5 minutes while I'm instilling the drops. But before then, I'll pull the hair up and backward. Then have her stay sideways. Then I instill the drops in the hair for 5 minutes. So that is that for the ear. Then for applying a patch on the skin. To apply a patch, in all these processes, don't let me forget, I will be performing hand hygiene before I do any of these steps. I'll make sure I take off the glove I have for the first one. I'll take it off, perform hand hygiene before I go to the next step. For the applying the patch, after I've performed hand hygiene, I will make sure I remove the old patch carefully from the skin. Once it is removed, I will wash the residual area. I will wash it perfectly clean. Once it is washed, I will make sure immediately I take off the hand glove, perform hand hygiene, and put on a new glove. Then I'm going to put a new patch. Then on the new patch, I'm going to inscribe on it the date, the time, and my initials. This will help the next person that will walk after me to know when to remove the patch. So I'll put the patch smoothly, cleanly on the non-hairy part of the skin. Then that is that for the patch. For the enema, what I will do is, in case it's going to be done in the bed, on the bed where the patient is sleeping, I will make sure that there is a waterproof pad on the bed. Then I'll make sure I provide a bedpan, a commode, or an access to the toilet. Then I'll have the enema rectal tube right here. I'll make sure it is lubricated. Before doing that, I will have done my hand hygiene. Please don't always forget, I will have done my hand hygiene. So I'll make sure I lubricate 3 to 4 cm of the rectal tube. So after lubricating for 3 cm, so I will locate the anus. I'll make sure that the bed is already fixed. I'll make sure the bed is already fixed. I'll make sure that the patient is in a good position on the bed. If the right rail and the left rail, I'll make sure the patient is sleeping towards the left rail while I'll be walking through the right rail. I'll make sure while the patient is sleeping, I'll locate the buttocks and I'll locate the anus. Then I'll gently insert the rectal tube towards the anus, in the anus towards the umbilicus. So I'll do that gently. I'll make sure it goes in. Then I'll leave it for like 5 to 15 minutes for the patient to be able to go. So once I'm done with that, I'll use my paper towel to cover the enema, and I'll discard this, put it in trash. So that is it. Then I'll take off my hand glove immediately and I'll perform perineal care. I'll put the bed back to the right position and make sure the patient is comfortable. Thank you.